Yeah, so we will be recording now. So, welcome everybody to this webinar. It is called Discover the Master in Public Health in International Health. So, my name is Victoria Castillo Veitia, and I will be your host for this session. So, today we are here to talk about what is the Masters. That is just a full online program designed to prepare professionals to tackle complex like global health challenges. So the program is 100% online and it is available in English and Spanish, as well as we are accredited by the Council of Education for Public Health, and our students can complete the degree in 2 years, just from anywhere in the world. So we are also excited to share the our next upcoming cohort that begins in November 3rd. And you just have time to apply for us. So you have time today, tomorrow, this week, next week, so that you can just submit your application with us. And the application is in our webpage, as I mentioned at the first part, phsu.edu. So for guidance or assistance for your application, feel free to contact us, as well as we have phone, text, we have WhatsApp, and our number is 787-664-5254. As well as today, we have our Professor Miguel Cruz, who is an expert in global health, and he is key faculty member of our program that will be sharing more a bit about what is international health. So that is special. So at the end of the interview, I will be also opening a space for your questions. So feel free to drop them in the chat at any time, and we will be going at it by the end. So welcome, Professor Cruz. It is wonderful to have you here with us. Oh, doctor, yeah, you are missing you're muted.
Sorry, well, thank you for having me here. So I'm happy to join the new group or the new crew that is going to be coming in, and I'm happy to answer any questions. Thanks for the label expert. I know expert. I have experience in public health. I work in public health for the last 25 years at the local, regional, national, international level. So I'm here to do my best to inform our potential candidates. To the MPH program.
That is perfect. So we will start with a general overview. So I will be asking some questions, and our viewers can just keep on watching us. So could you start by telling us a little bit about the Master of Public Health and the International Health Program?
Well, this program is a program that is totally online, so it's kind of convenient for people that work. Many of us didn't have it easy, so we had to work and study now just to get here. So this program offers the flexibility for people to attend at their own pace. And we have a very robust cadre of professors and instructors, and many of them have vast experience in the field of public health and also international and global health cooperation. So I think we are in a good position to help students, take that journey.
Perfect. That was a great introduction. Thank you, Professor. So, from your perspective, what makes like this program unique compared to other APH programs? Because we mentioned that it is also online and you can do it at your own pace and by your home anywhere in the world.
Well, when I look back at my previous work in public health with some agencies, that included federal agencies, some consulting. I think that global health is a different type of program. It's kind of more challenging to to get things done. In the international context, things are not like here in the United States. So having staff and professors that have experience in that area can help the students navigate some of those challenges and be successful at the end of the training, and being able to accomplish what they're supposed to be accomplishing here, which is getting their MPH online. I think global health is a very rewarding field. It takes a little bit more work, and I give you a quick example. When you are in the regular MPH program and you are going to do a program, a project about let's say children's immunization, you can contact the immunization program and get your data. If you want to do a project at the international level, then you have to contact the big actors or big players in international health and get information from there. The WHO, Gavi, some of the big foundations, and so on. So, it takes you to the next level of comfort. So that's what I like, for our students to join the program and to experience that challenge and and know that we are here to support you all the way.
Yeah, so it has like a different approach of what is like a normal master program because it is in health, in such as public health, that it's not any type of health program. So, as well as how is the curricular prepare the students to address the global health? Because you mentioned that they can do like vaccine, they need to check with the big guys to make sure how to collect the data. So, yeah.
Yes, think about it. Just when you're doing like a research project, a research project in the state or in the United States, you go through an IRB process. Here, is different. You are working with ministries of health. You are working with NGOs, non-governmental organizations. You're working with the foundations where you're working with the UN, with the WHO, which is like the global public health entity out there. So, the players are exponentially higher and complicated. So, it's definitely a win-win for anyone that want to join a program like this, so they can get out of the comfort zone and know that that what you're doing, you are contributing to improve the health of people around the world, not only in Puerto Rico.
Perfect. That is amazing. So, and how is the research integrated into the learning experience of our students? So
Yes. Well,
they
definitely, research, is an area that requires, very close consultation and support from us, from the professors to help the students navigate. It can be frustrating, okay, when you are working with 190, 200 different countries, and you want to do a project in a different country, and systems are more different there. So in order for you to being able to navigate those challenges, you need to stay close, to you, professors, and we're here all the way with you on this journey.
Yeah, that is amazing. So, since the program is like 100% online, I'm sure there are many prospect students that are curious about the virtual classroom experience. So, how do students interact with the faculty, classmates? How do they do the networking in that environment of being online?
Yes, yeah. Well, we have our regular lectures, no, and And then we also have what we call virtual office hours, where students can join us and they can ask questions. They can talk about I'm the kind of professor that want to hear about your goals. Are you thinking about a research project? That's the moment where we are there, to interact with you. Other ways that we interact with the students is through regular email, text, or just setting up appointments with your professor so you can get one-on-one, with your professor to address any concerns or deal with any kind of issues. We are adults. We all working people, so I know that it's different, but we have your back. I understand that there are always things that want to pull you away from the training that you're doing, but the important thing is to stay focused, to stay on target, and we are going to help you. We have the resources, and it's not only about you professors, but the university has a support system that we can. I'm not an expert on dealing with some situations. I would call the department and request assistance, one-on-one with the particular student. So we have a support mechanism for you, and again, we want to offer any assistance necessary and access to the professors and other resources that can help you, be successful in this journey.
Thank you, Professor. So in terms of support, so what kind of academic or technical support is available for online students? So you
Well,
mentioned,
it's just the usual, since you're dealing with information technology, for the most, we have a very good support at the university. I'm based in Atlanta, Georgia, and I can tell you that the support system is very responsive. So all the materials are online. You can look at the materials. We post some of the journal articles. We have resources at the library, okay? Like the textbook is available at the library of Ponce Health Sciences University. We have some licenses, so people can use those resources to stay, uh, on task, and make sure that they don't miss any classes because they don't have some resources. And again, the primary assistance that you can reach to is you, professor. If I'm your professor, I want to know, hey, there's a challenge, there is a situation, you're having problems with the internet. Those kind of things happen. Like today, I was telling Victoria that for the first time, for the first time in months, there was a power outage. So I was concerned about being able to meet this webinar, but here we are. So we all face things, but we are here to support you.
yes, that is great to know. So there is like a common question that we get from prospective applicants about the background experience. So is previous experience in healthcare or public health required to apply to the program?
Not necessarily. I think that public health is open, or with open arms to anyone that is interested in helping in improving the lives and the health status of people, not only here in the United States but around the world. That's our main core mission. Health is a human right, and we're here to ensure that we follow that principle and that we make lives better for people anywhere around the world. People die unnecessarily of things and conditions that are preventable or that can be treated. So when we are working in international health, we dealing with a lot of issues, poverty, brain drain, physicians are leaving, limited resources, lack of financing, lack of experience, so we are here to trying to get you ready for all that, and I think we have a good cadre of professors that can guide you on that endeavor.
That is very helpful. Thank you very much, Professor. So, for those who might be thinking about applying, what advice would you give to someone who is considering to join us?
Well, if are you talking about joining public health or joining the global health or the international program?
The Master of Public Health and International.
Well, I'll say, just make sure that contact Victoria, no? And Victoria can put you in contact with one of us. And we can have one-on-one. Many of us are available to talk. Sometimes there are these uncertainties. Before I jump into public health, I was planning to jump into nursing, and then I took my first course in public health, and I was fascinated. So here I am, 25 years later, still on the game, which is, protecting people and improving the health status of people everywhere. So, it's do your own research. If you have any doubts, contact the university. We want to make sure that when you make that decision, and it's also a responsibility and a financial uh, decision, that you're comfortable with doing that, and that you feel that you are in the right place.
That is a wonderful advice. Thank you, Professor. So, finally, let's talk about what comes after graduation. So, what type of professional opportunities are available for our graduates to this program?
Well, the field of public health is wide open. By the time that you graduate, you are going to be having a knowledge and maybe some skills in different areas of public health. So this is not just straight, global health. You're gonna be learning, or refreshing about infectious diseases, health communications, environmental health, and all that. So when you graduate, from a global health program or international program, just as you do with any other MPH, you will have options to work at the local, state level. You can work with non-governmental organizations. You can join some of these big international groups at agencies that are doing work, everywhere in the world. So you're gonna be prepared with you're gonna have the basics. You're gonna have the foundation to go to any type of job that involves health. So take the challenge. Don't be afraid, and trust yourself. What you're doing. It's needed. We need public health professionals that have a international and global vision about what's going on with health around the world. We are facing a lot of challenges, and many of that they are happening out there. But it's gonna be up to all of you to take it to the next level. To bring countries back. Let's say from the COVID pandemic, many are still struggling. Many health systems need sorry, we need people with the experience in data management, data scientists. We need water sanitation and hygiene specialists. Those jobs are still there, and we need people that are trained, to do best for the rest of the people.
That is really important. And thank you so much, Professor. So, as a final thought, how does the program prepare our students for leadership roles that are such as global health?
Well, and that's a very good question, because sometimes people in global health don't want to be the leaders, but they want to be the epidemiologists, but they want to be the environmental health officer that goes out to the community. Our program has training, okay, in management, in public health management, but they're people that they are here to be bosses, and there are people that want to have the opportunity to work one-on-one with people and with agencies and with groups and with organizations, where sometimes when you the leader, you cannot do that. No, you have higher responsibilities. So that's why I say it's good to be on either side. But if you want to be a leader, this is the also the place to do it and to learn the skill sets and the experiences that you're gonna need to be a good humble leader in international health.
Thank you very much, Professor. And thank you for sharing all of these insights. So before we move on into closing our remarks, I would like to remind everyone that if you have any questions for Professor Cruz, you can just type them in our Q&A section right now. So we will be addressing them, some of them, or shortly. And once again, thank you so much, Professor, for joining us today and sharing all of your expertise on what is the Master of Public Health and International Health. And thank you, everyone who just joined us today. So, if you're passionate and you want to improve the health program, yeah, just 1 minute. Yeah. So I can see now the Q&A. Sorry. So let me just move this here. So if you're passionate about improving the health of global scale and ready to advance your career, like this is the program that is the perfect fit for you. So I will be searching right now. I have questions right here. The first one is, even if the master program is online, can students visit the campus to study or complete assignments there? Also, how do international students complete their practicum? So, Professor, do you want to answer this one?
Yes, well, the yes, I live in Atlanta, but I love to go to the university. I shake hands with people, meet with the students. I usually announce when I'm going to be on campus, so students can plan accordingly, since many of them work. And the second part of the question, I didn't hear that well.
Yeah, so the other question, well, part of that question says that can the student visit the campus to study or complete the assignment?
Yes, I mean, there's it's a beautiful new campus. We have excellent facilities, a nice library, and I think it's a must that if you have the chance, when you visit, Puerto Rico, to drop by and sit down and tell us about your experience. We try and we want to be a player in international public health. So your feedback is definitely appreciated. Or if you want to congratulate and highlight areas of strength, we also want to hear that. Or you have any complaints that we can address. We also want to hear about that. We want to give you a good experience. But would you welcome anytime.
Thank you. Also, how do international students like complete their practicum?
Yes, that's I'm not there yet, because I don't have any students yet that are applying to do practicum. But that's a good question, and we will be happy to give you that feedback at a later date.
Yes, so I have an idea to answer your question, Biancali. So the professors of each course will be contributing and guiding you to make your practicum. So they will be doing an appointment with you to make sure that you comply with what you need for the program.
Thank
Also,
you.
I have another question that says, Understood. I am concerned about financial aids or loans. Like if I decide to start November, I don't have enough time to have the money to pay for the classes. Do you offer scholarships or extensions? Also, about the letters of recommendation, I'm not sure to be able to find them for this Friday. Last day application stated on the page. Can I use the one that I have in my portfolio? I got them last semester of bachelor's for medical application for the community and academic service. So let me just, yeah. So I can answer this one. So for the scholarships and or extensions in our page of phsu.edu, we have a section about the scholarships that we offer for each program as well as for each student. And the extension for financial aid, you can just call us and we can just transfer your call to our colleagues who know a lot about and more about this information. Also, for your letter of recommendation, we also recommend you can have one letter of professor as well as one letter of supervisor, or if you have done um, um, like community service, you can just put on a letter of recommendation for that too. I hope I answer your question. So I also have another question and it says, I have a bachelor degree in general studies, but I'm also a medical lab scientist license. Would this help with the requirements needed for the program? So I think I can also answer a bit about this question. So what we need to know about you and evaluate you, we need your transcript. And your transcript should have some prerequisite courses that require the program. After you comply or submit your application, you can just send us that information so that we can make sure. And if you don't comply, we can also talk about some alternatives to do it. Okay. But it is important to have social sciences, 6 credits, 3 credits of general psychology, 6 credits of general sciences, and 3 credits of math. So keep that in mind. So I also have another question, Professor, and it says, I just wanted to ask, what are the job opportunities currently in Puerto Rico and United States?
Well, when you with your background, okay, it's just in general public health, you have the knowledge, but and skills now to working with the Department of Health, with the county health department. You can be in a board, for example, you can work with federal agencies like the EPA, the U.S. Department of Agriculture. Um, those are, agencies that use public health components, like, people that have public health background, Puerto Rico, OSHA, for example, if you have training in environmental and industrial hygiene training, you can work in Puerto Rico. You can join the military, but the military takes people with public health training, and so there are, all kinds of opportunities there. There are NGOs. You can be a public health advisor. You can work for the Centers for Disease Control, agencies like that for the U.S. Department of Health, um, which has an umbrella of different public health agencies, many of which have offices in Puerto Rico. So, the field is wide open. What I tell students that I have done a lot of mentoring in the past with fellows and interns is to try to learn a little bit about every area of public health, because that opens the field for you to land in a lot of public health positions that out there, try to, be more like a generalist. Some people say, I just want to do data, but if they're not data jobs, but if you can land, a job as an analyst or as a project manager in public health, and then do your transition to the epidemiologist position later, think about all those things, all the ways that you can prepare yourself to land the ideal job. Sometimes it takes a little detour. Some people say, well, I wanna do a job and I wanna work in South Africa. Well, first you need to get the training, then you might not get that job in South Africa first. You might have a different public health job, but then you are very prepared to take that job in South Africa when it comes available. So, don't narrow the scope of your opportunities. Always think big, think global, think international, because the opportunities are out there for you.
Definitely. Thank you, Professor.
Get
And
out of your comfort zone.
definitely. So I also have a question, and it's what about if you live in the USA? How do we complete our clinical hours, if any?
No, I leave that to you, Victoria.
Yeah,
Talk about.
sure. So there will be a professor or doctor who will be working the clinical hours as well as they will be doing appointments with each student so they can just comply being where they are. So they will be keeping contact. Also, I have another question, and it's what are the course requirements and GPA minimum in order to apply for this program? So I mentioned the four courses that you should have that are prerequisites, such as general sciences, 6 credits, general social sciences, 6 credits, 3 credits of math, and 3 credits of general psychology. As well, for the minimum GPA should be 2.75 and above. And I think this is the last one that I have. Would completing the program in English provide any additional advantages for the global career opportunities?
Well, I say, English is the international language, no, and it's also the language used, among others, but it's one of the, I say, but the main language in which the World Health Organization does their business. So it's good to have a good base of English because, especially for international jobs, that might be a requirement because English is the standard language for all this, international business as well as, health and public health.
Perfect, thank you. And this is the last question. I love to know the final evaluate that works, if there is a thesis, a project required, and are those done virtually or on campus? So I can answer this question. So I think there is a project, but I need to do a double check. So I will keep your name, Sarah, and reach out to you. And they are done virtually since you guys are going to be online. So everything should be online. So that would be all for everyone. Thank you for coming here and being with us. Just remember that our next cohort starts November 3rd, so there is still time to apply. You can start your application today by visiting us at phsu.edu. And for orientation or questions, you can just reach out to us via phone, text, email. We have WhatsApp, and our number is 787 664 5247. So anything or any question that you have, you can just reach out to us. So that will be all for our questions. Thank you everybody for being here today. And we are looking forward to welcoming you as soon as you want to be part of the global health community, especially in the international health.
Well, I just want to say to close that I'm very uh, happy to be a professor at Ponce, University Health Services University, and I look forward to meet some of you. I want to hear about your interest in and projects in global health. And like I say, you can watch from another program or you can get involved in international health. So I invite you to join us in this journey. We hope that it's going to be fun, it's going to be interesting, and it's going to be very valuable for you to understand, and to learn how to help people around the world. Thank you.
Yes. So lastly, thank you, Professor. So lastly, you can just call us at 787-664-5247. Sorry. Oh, 54. Sorry. I am so sorry. My numbers have been merged. So I'm sorry, but 787-664-5254. I will be putting it in the chat if you have any questions. That will be all. Thank you, everybody.